It's been nearly 24 years since Dr. Pankaj Shrivastav first came to Dubai from London, United Kingdom. In 1991, he started the UAE's first infertility unit under the Dubai government's patronage, and that went on to become an incredibly successful program. Then, in 2004, he established his own infertility hospital, the Conceive Gynecology and Fertility Hospital. Having devoted his medical career to reproductive medicine, Dr. Pankaj Shrivastav has been at the forefront of building families not just in the UAE, but across the globe. Today, he has been instrumental in the birth process of close to 5,000 babies. World-renowned, widely respected, and very loved for the warmth and the sincerity with which he approaches his work, Dr. Pankaj Shrivastav is a household name in the United Arab Emirates. On a personal note, I have had the fortune of knowing the man behind the physician, and as such, it gives me great pleasure to have this little chat with him today and talk all things about infertility. It's my attempt to educate the public and spread awareness about this growing concern. So without much further ado, hi Dad!
How are you, Daamini?
Thank you for letting me do this and putting you on the spot. Why is infertility such an issue today? Why is it becoming such a growing concern?
Infertility exists in roughly 15% of couples all over the world. Probably because of bad genes,
Oh gosh.
bad lifestyles.
So what do you mean lifestyle? I mean,
Well,
what are we doing wrong?
for one, in the old days, even with the same genes, because girls were slimmer, they were more active, they were doing a lot more work, they weren't overweight.
Okay.
But now, with the present lifestyle where there's minimal activity in day-to-day existence, food is much, much richer.
Yeah, I'll
Fast
say.
foods are available aplenty. Pepsi, chocolates, ice cream are the norm. Girls are putting on much more weight. And this tips the balance in favor of the full-blown polycystic ovarian syndrome.
Okay.
Associated with diabetes is a condition that afflicts women called polycystic ovarian disease. We see a lot of polycystic ovarian disease in the UAE.
Okay. Is there anything else that people here are doing wrong in terms of, well, I mean, I hate to say this because I know this, but smoking and drinking is never recommended by any physician.
Well, smoking we know is definitely highly detrimental to both male and female fertility.
Okay.
We know that girls who smoke run out of eggs and reach menopause roughly about 4 to 5 years before girls who don't smoke. And this is not just active smoking, even passive smoking. If
So
the
their
partner
partner is smoking
is
or-
smoking, they are more likely to run out of eggs 2 or 3 years before they would normally have done so.
And what about shisha? Because that is a huge problem here. I mean, I've heard shisha is, 1 hour of shisha is about 80 cigarettes.
Well, I don't think it's equivalent to 80, but more like, say, 20. But
So
yes,
it's bad enough.
shisha is terrible.
Yeah.
It's considered to be recreational smoking. People sit around and have a shisha. But if you're doing it on a regular basis, it's very bad not only for the eggs, but it's bad for sperm as well. We know that most men would like to believe that it's a problem that only affects women. But
Doesn't
it's not
surprise
true.
me.
Not true, because when we analyze all the patients, all the couples who come in to see us for their fertility problems, we find that in about 35% of the times, it's a pure male factor. There's a problem with the man's semen, his sperm is weak, the number is low, they don't swim well enough, they have abnormal shapes, and that is the reason why this couple isn't able to achieve a pregnancy.
Earlier generations, so like yours or your fathers and your parents, it was probably that they were generally fitter beings. I mean, they walked more. I know they played outside more. there were less external toxins that they were exposed
No,
to.
very true, because
So, yeah.
we are exposed to far more environmental toxins
Yes.
than the previous generations were. Lots of chemicals which are present in the environment today are toxic to eggs and sperms, and these weren't there 25, 30 or 40 years ago.
Some fertility units boast of an 80% or a 90% success rate. Is that true?
Unfortunately, statistics can be manipulated the way you want to. Bearing in mind that in a natural cycle, the way God made us, our fertility per cycle is roughly 20 to 22%. So here in one cycle, you're able to give a
Almost
pregnancy
double.
almost double. So even though it's not 100%,
Yeah.
and the odds are still stacked against you,
Yeah.
but with IVF, we're doing better than what nature can achieve.
Okay. All these techniques are quite cool and very high tech, which probably means they're also very expensive. How do you sort of encourage your patients to go through with it?
We are very, very clear about this. We tell them for each individual age group, we tell them this is what your chances of conceiving are. This is how much it will cost you. They take the decision. Unfortunately, fertility treatment is not cheap.
No,
Fertility
it isn't.
treatment involves a lot of high-tech equipment.
Yeah.
It involves a lot of
Skills,
disposable,
expertise,
well,
isn't it?
skills, expertise, and a lot of disposable and expensive material that is used.
Right, so the costs just add
So
up, don't they?
Absolutely.
What is your advice? When should they come and see you?
The age of the wife is less than 35 years. If they've been trying for a year and they haven't achieved a pregnancy, they need help.
Okay.
If the woman is over 35 years of age, her time is short.
Okay.
She needs to move faster. So if they've tried for 6 months and haven't achieved a pregnancy,
Right.
they should seek fertility advice.
Obviously, I'm sure all the information on how to contact you is on the website. So,
Yes.
conceivivf.com.
That's the website they need to look up. Telephone numbers, locations, everything is available there. They're most welcome to come in and have a chat.